So let's talk about something we all do. When you're not feeling well, who do you turn to? In this digital age, the answer is complicated. Today, we're going to investigate who we can actually trust for health advice online. Let's get into it.
You know exactly how it starts. That little scratch in your throat, maybe a headache that just won't quit. And what's your first move? It's probably not dialing your doctor, right? It's pulling out your phone and typing those symptoms into a search bar. We've absolutely all been there. I mean, why wouldn't we? It's instant, it's easy, and the information is right there. But when we log on, we're basically walking into a digital clinic with two very different kinds of doctors on call.
On one side, you've got the social media doctor. This is all the collective advice from forums, Facebook groups, you name it, the wisdom of the crowd. And on the other side, you've got the AI doctor, these incredibly powerful chatbots that can spit out complex medical advice in a heartbeat. The question is, who do you trust?
This right here is the heart of the mystery we're cracking open today. And our guide for this investigation is a really brilliant PhD dissertation by Gagaliwango Marvin. We're going to follow the clues he uncovered to get to the bottom of digital health trust.
Okay, so first up, let's put our first suspect on the stand, the social media doctor. You know, researchers have been trying to solve this problem for a while now. How do you possibly sort the good advice from the bad in all that online noise? Well, their approach was pretty fascinating. To figure out this very human problem, they decided to build a machine to do the work. They trained an AI, feeding it just tons and tons of posts from health forums. Some of those posts were from actual verified doctors, and others were just from regular folks sharing their experiences. The AI's one job was to learn how to tell them apart.
Which leads to the million-dollar question, right? Can a machine really pick a real doctor out of a digital crowd? I mean, if it could, that would be a total game changer for finding reliable info online. So they ran the experiment, and the results, well, they were a huge surprise.
The AI was only 56% accurate. Just let that sink in for a second. That is barely better than just flipping a coin. The very machine that was designed to find the expert was basically just guessing. So what on earth went wrong? Well, the reason it failed is actually incredible. The research calls it linguistic indistinguishability. Turns out, over the years, we've all learned to talk like doctors online. We use the right jargon, we adopt that confident tone. The way we talk about health has become so similar that even a powerful AI can't tell the difference between a real expert and a well-meaning amateur. So the big takeaway? Relying on human advice online is a real minefield. Okay, so if the social media doctor is unreliable, let's turn our investigation to suspect number 2, the AI doctor itself. Can we just cut out the middleman and ask a chatbot for help? Well, let's look at the case against it. And the evidence is pretty damning. First off, you have AI hallucinations. This is when the AI just makes stuff up. It says something that sounds perfectly correct, but is actually clinically wrong. Then there's context blindness. An AI trained in the US has no idea what hospitals or medicines are available in, say, rural Kenya. And this leads to even bigger issues like epistemic erasure, where the AI only knows about Western medicine and ignores centuries of local health knowledge. And finally, data colonialism, where big tech companies use health data from developing nations to train their AI, but those communities see none of the benefits.
So, here we are. We're at a critical point in our investigation. The crowd is unreliable, and the machine is deeply flawed. It kind of feels like we've hit a dead end, doesn't it? But this is exactly where the research flips the script and offers a real breakthrough.
See, instead of making us choose between these two imperfect options, the dissertation lays out a brand new system. It's a way to build an AI that we can actually trust by completely changing the way it learns in the first place.
And the solution is this really smart 3-step process that puts human experts right back in the loop. So, step 1, the AI gives it a first shot and creates a draft answer. But, and this is the most important part, that answer doesn't go to the public. Instead, in step 2, real human doctors review it, fix any mistakes, and make it better. Then, in step 3, that perfect expert-approved answer gets saved in a special trusted database. So the AI is always learning from the best with a human safety check every single time. So, the big question is, does this new human-in-the-loop system actually work better? Well, the researchers put it to the test. They compared this new method against other common ways of making AI more reliable. And the results? They were crystal clear. So they tested a few different techniques. Think of the first one, RAG, as an AI that has an open book test. It can look things up, but it doesn't really understand them. The second one, GRAFT, is like an AI that is crammed for the test and memorized the book. But the clear winner was GRAFT. This is like an AI that didn't just study the book, it's your whole concept map. It doesn't just know facts, it understands how they all connect. And as you can see, that deeper understanding made the GRAFT system way more fair, robust, and accurate.
So after all of this, the final verdict of our investigation is in. The question was never, should we trust humans or machines? That was the wrong question all along. The real answer is building a partnership. Trust isn't going to be found in a perfect algorithm or in the wisdom of the crowd. It's built in a system where the authority of human experts guides the incredible power of AI.
And that leaves us with one last big idea to chew on. As AI gets woven into every part of our lives, this research makes a powerful case that for AI to ever truly earn our trust, especially when it comes to something as important as our health, it might always need a human in the loop, making sure it's safe, fair, and genuinely helpful. Definitely something to think about.